Hi everyone, today I'd like to discuss a growing concern in public health. My topic is ultra-processed foods and their potential role in food addiction. There is a debate that centers on whether these foods are driving health crises by altering eating behaviors and fostering dependence. Now, what are ultra-processed foods? Some examples are sugary cereals, sodas, and fast foods. As you can see, some of these foods are very highly calorie dense, and for the US in particular, they make up 21% of our average diet, and it's a growing concern globally. Some of the health effects linked to ultra processed foods are obesity, diabetes, heart disease, all which are leading causes of death worldwide. For us, for public health professionals, understanding that this issue is of great concern is critical because these diseases, they strain the healthcare systems and they reduce life expectancy. And if food addiction is real, it could really reshape how we approach prevention and treatment. So, with the question of whether ultra processed foods are addictive, there are studies that either support that these foods are highly engineered to be highly palatable, um, triggering of the dopamine pathways, and therefore they can be addictive to people and of all ages. There's also research that indicates that there could be other lifestyle factors that are contributing to these chronic diseases and not so much the ultra processed foods. And so here is where the debate lies. Now, with the current debate about food addiction, um, we we should discuss that the experts are still debating this. They are conducting further research about food addiction. Um, Based on my understanding, we have to label foods and correctly inform the public, and we have to conduct further research about the neurobiological effects of these foods and what their role is in overeating. As public health professionals, what we can do is just create some advocacy for policymakers and health advocates to really push back against the industry and really promote regulation in the marketing and seek to improve food labeling. And so here is where my recommendations lie. So, as I said before, we do need some more research, really just to link ultra processed foods with addictive behavior. And so we can do so by creating public education campaigns that seek to highlight the health risks of eating these foods, really push for policymakers to create stricter regulations on marketing to children and being transparent, having transparent food labeling. Uh, Finally, we must request that healthcare providers um, approach this topic as a multidisciplinary approach, not only having nutritional counseling, but also psychological support and bring in those community interventions to address unhealthy eating behaviors. And so, in closing, this debate over ultra processed foods and food addiction is really a wake up call for public health professionals. It's an important topic because tackling this issue could prevent millions of deaths and really help to improve the quality of life, not only here for Americans, but also worldwide. Thank you so much.